All right, welcome everyone. I guess if anyone wants to get seated, now would be a good time. This is the MedTech Family Office panel. I'm Colin Whedon. I'm CEO of the Boston Innovation Capital Group, which is a subsidiary of Life Science Nation. We do all the placements for clients, for you guys, help them raise money, et cetera, formally. What I thought we would do today with this group is typically what I like to do is talk about how each investor views their space, what they as an investor, what they view as an investor sets them apart from others, and how they would suggest a company approach them specifically in this space to give some guidance. Each person will go through their own unique approach. And then I thought we would just open up for Q&A because I find those to be a little bit more valuable to everyone involved.
Sure. So I'm Brian Grolke. I'm a partner with Volcano Capital, which is a early and seed stage medical device focused venture capital firm, but it's a single LP, so we're on the right panel, I guess, for now. We tend to get involved pretty early. We put in around $2 to $3 million typically per round. We'll support the company through multiple rounds of financing. I think what's great about the family offices is that we don't have the same constraints that a fund would have as far as having to return capital. The way Volcano got started actually was that a very successful medical device entrepreneur exited his business to GE in 2008. And so he took some of that capital and started Volcano with that. And so in the extreme, he held that investment for 35 thereabout years. So there's no really requirement that we have to get in and out by year 7 or anything like that. So we're pretty flexible, but we do want to make sure that the assets continue to appreciate in value. And obviously, if we get a good offer on the table early, we're more than happy to entertain that.
Thanks.
I'm Ron Palivuta with the Palivuta Group. This past August we just celebrated our 20th year, so I feel like a bunch of dinosaurs. But over the span of 2 decades, we've slowly grew our portfolio. We focus on a variety of different sectors, including the healthcare sectors, which is why I'm here today. We're also focused on robotics. We're focused on digital media. In the healthcare sector, we have a fund called the Health Tech Fund. The focus of that is to look at companies that reduce the cost of healthcare. I need to clarify that for you guys. Reduce the cost of healthcare to consumers, not necessarily to healthcare providers. I always need to make that distinction. I certainly encourage you guys to get funded to find a cure for cancer, but I cannot support you through this particular fund. We focus on things like computational biology, genomics, the big data of everything. We have lab on a chip technology that we're very excited about. Some really interesting things are happening. You can visit our website if you want. Come talk to me. Remote monitoring as well. That's about it. We focus on early stage investments, and we're not afraid to wait a very long time for things to mature. The oldest investment we have, we made in 1997. It is also the most profitable thing we have. So we're not afraid to really engage longer term. The way that I view our portfolio is as an ecosystem. There's a mandate, obviously, to have an economic benefit for us, but there's also a strategic objective as well. We look at companies that add value to our existing portfolio. So that's kind of our dual mandate. I don't like the term family office. I think it implies a much more financial, economic objective. We essentially run like a corporate VC. So we have a very robust internal IP department. I'm a scientist turned VC, I guess. But we have a very robust research and development aspect as well.
With Broadview Ventures, we're actually in many ways similar to Volcano. We're a single LP venture fund. We're based here in Boston. I will say that you could probably put me on a venture capital panel, a venture philanthropy panel, or a family office panel, because really our model has elements of all three. So in most ways, the way we invest is very much like venture capitalists. We make equity investments. We go in early at the seed stage or Series A. We do devices, therapeutics, regenerative therapies, a bit in diagnostics, not a whole lot in health IT, but certainly open to it. And we take a board position in a similar way to the way VCs do. We're venture philanthropic in that we are a single LP fund. All of our funding comes from a family trust that's devoted to cardiovascular disease and stroke, and so by extension we follow that mandate. So we're much more narrowly focused from a therapeutic area standpoint than most venture capitalists you'll meet. And then again, we're a family office because all of our financing comes from a single family trust. That family had a history of cardiovascular disease and stroke, a very long and serious one, and so they decided to devote part of their fortune to supporting that effort. And on the family side, there's also a foundation that makes grants on a very substantive scale directly to researchers. So there's the grant-making arm, and then there's Broadview, the investment arm. We do investments, like I said, seed stage, Series A, typically about $1 million per company. And we're really meant to be a one-time investor, so we typically invest once to get companies across a critical gap. Usually we're funding IND-enabling studies, first-in-human studies. Since we're on the MedTech panel, that would be, prototype advancement, again, first-in-human work. That's really our sweet spot. We're open to either investing alone or as part of a small syndicate, and we've done both. We've done 27 investments to date, and to the point of long horizons and needing to have that ability to to really be in it for the long haul. I do think that's one advantage of being in the kind of family office space. We're not a 10-year model. We're not tied to deploying all of our capital in the first 5 years and then reaping the rewards in the final 5. And so one example is, actually our first really big exit is the cardiac valve technologies acquisition by Edwards that just took place for $400 million. That was our very first investment. That was 7.5 years ago. So we expect those type of timelines and those type of horizons to keep happening in our portfolios, and we realize we need to have much more than a 10-year outlook. So that's how we were set up, and just a couple other things to mention. We are an evergreen fund, another way in which we're unique, so our financial ROI does just get plowed back into further investments, yet another way in which we're philanthropic.
So we're a little bit different than the VCs that are here or the incubators. We are healthcare domain-only investors. We represent high net worth and family offices. We invest all across the healthcare sector, with the exception of biotech. We tend to be with a shorter horizon. I mean, we're not looking for 10 years investment. We're looking for 3 to 4 to 5 years investments. We're looking for a predefined timeline for an exit based on either dates, basically on time, revenue, profitability, or market condition. And an example, we just sold one of our healthcare IT companies because the market decided to view companies as a multiple of revenue as opposed to multiple of EBITDA, and that's a good time to sell. We are extremely involved in the companies. We are, in a way, control freaks. Now, the way I'm saying that is it's not only a board seat. In many cases, we install our C-level people in the companies, especially in smaller companies, whereby we put the financial guys in because we like to control the money. I have a saying that I use all the time: we lost a lot of money sitting at the end of the bus. We not sit next to the bus driver, or we drive the bus. In case the driver is not doing well, we'll throw him out and we'll put someone else in. We're very, very much involved. For example, my partner Sheila is the CEO of our biggest company called Patient Matters, and my other partner is the director of finance of 2 companies that we just made an investment last year, Delphi and Infinity, and he's the director of finance and controlling everything to do with the money. Now, the team itself comes from kind of a different background. I'm coming actually from the hedge fund. I was at Oracle for many years. But some of my partners are coming from investment banking, from operating companies, from investment banking, from C-level basically at CareMedic, at Envoy Medical, and those kind of companies. We look at basically across the field, so we tend to be more of growth capital. We like companies that have revenue, but companies that are about to have revenue, that are very close to have revenue. So there's there's kind of a timeline for revenue generation. Because I don't like to see a company with a big black hole. Okay, let's do a $10 million right now, and we need another $20 million next year or 2 years down the road. We need a clear path to be able to exit. Now, the investor base is very patient, even so we are not. We are looking for about a 4-year to 5-year exit. We are right now in the process of changing our model a little bit from only representing family offices and high net worth into a very unique PE model, just because our pipeline is bigger, our deal size got bigger, and we see many opportunities, and therefore we're building an infrastructure for that. And as a result, we are setting up a unique quasi-PE model that looks more like a direct investment and give all the advantage of direct investment with maintaining our strategy and our style. That's basically who we are.
I'm this year the founder of BSI Capital Group, and we're based in Mexico City. I founded the company in 2011, and basically we started off as an investment bank offering services just in Mexico. But then through a series of events and personal preference, I became involved in life sciences and healthcare through an event in my family that everyone has had cancer, etc. So I became really focused on that. And BSI started a multi-family office platform to start investing solely in healthcare, just kind of broad. So we started off investing in a genomics company based in San Diego, so that was our first investment. And just recently, being now involved in the medtech field, we just finished up an investment and finish up the last details of that in a medtech company, actually introduced here by the RESI network. So that's pretty good news. And through Colin, actually, who made the connection. So we're very happy to be involved in medtech, and we're very happy to get involved in companies in the U.S. where they can see BSI Capital being a partner in Mexico and Latin America. So sort of our business model goes into investing in the company, even if it's early stage, we see the opportunity that the company has a clear path into an exit. But we also like to think of that we are a long-term partner, that we want to go along with management and grow the company to the point that we also see that if we are going to invest more capital in a different realm, that they can come to us, because we have the ability to go back into the family offices and say, this company needs more capital, will you be interested? So we want to say to the companies that don't be afraid to come back to BSI and say, we need more capital, because we understand that situations can happen, and there's growth opportunities in Mexico and Latin America where more capital might be needed. So that's where we stand, and we're looking into more opportunities and seeing that the space is growing significantly in medtech. So having that taste already and investing in this company already gives us a better taste of what's going to be next. So don't be afraid to send me some teasers along the way. So.
Great. I think that we can open it up for questions, and one I think we can talk a little bit about is if there's any comments on either the changing regulatory environment, or if anyone has any commentary on that, and we can kind of go from there. And then we'll take some comments from the audience, or questions from the audience. Anyone want to just talk about what they see as particular changes germane to where they are in their different niches?
I kind of phrased that the industry itself, and I'm not talking about medical device only, the industry itself is going what I call organized chaos. Organized because there's new rules, new delivery systems, new method of providing care. At the same time, it's really chaos. Everybody's trying to position themselves, both the VCs, the PEs, and the strategic guys. And that's great, tremendous opportunity right now. At the same time, you really have to pick the spots that there is a real path to success. That means everybody can do the product analysis and the market analysis, and there's a need or there is no need. The question is the strategy that the management is having at this point is applicable to the market, and whether or not the market will accept it. That's why I think our shorter term, not 10 years, we're looking at 4 years investment, is because the market is going to change dramatically over the next 4 or 5 years. It's not going to be the same that you're looking at right now in 4 or 5 years, and if the opportunity arises to get an exit, you should take it. I've seen too many companies go from $0 to $200 million back to zero within about 24 months. And can't be too greedy. We've met too many management that are just too greedy, they're not experienced. What I see here actually for the meeting that I had this morning, I'm seeing a lot of companies hiring veteran CEOs to come run their company, which is great. Those people had exits in the past, they know what they're doing. You can't just always push it to the next level and say, hey, we're going to get $400 million. Forget it, take the 200, start another company. It's just, the dynamic of the market is changing rapidly. If you look at what was last year and what's this year, it's totally different. Even the buzzword, ACO model in the hospital sector, it may go away. I mean, we're seeing actually people bailing out of this model because it doesn't work. So that's kind of my advice.
I'd like to echo that. There's a lot of innovation that is coming down the pike that's been kind of incubating over the last 10 years or so that is ready to launch, and it is truly disruptive. For example, diagnostic test 10 years ago might have cost, a genomic diagnostic test 10 years ago might have cost, let's say, $5,000 to run at a lab. 5 years ago, you could do it at a point of care at the doctor's office for maybe $500. Now you can do it lab on a chip, $5. And by the way, as long as I'm running one diagnostic test for one disease, I can do another 150 at the same time. That's disruptive. And that lab on a chip, we can do it in the field. And if you are able to get an exit, take it. Take your money and run.
I want to add one more thing, that some of the smaller companies or in different stages are not paying attention to the outside world, to the market. This year, we lost 2 opportunities because 2 PE funds came in that never done a healthcare deal, decided they need exposure to the healthcare deal, decided to pay 10 times revenue for a company or something like that. You got to pay attention that the cost of money right now for the public company is 0. So a public company can buy anything, it's going to be accretive. So this will change. In 5 years, maybe rates will be much higher. Cash deals will not be applicable. Stock deals, whatever the stock market is going to be. You've got to pay attention to what the market is also giving you. And a good example is last January 1st last year, we got getting calls from a bunch of PE funds to sell one of our companies. And my matrix was always on profitability, and they came in, okay, let's start with 2 times revenue. I said, let's talk to me tomorrow. I mean, this is not acceptable. The company was not making any money yet. And we sold it for 2 times revenue. So the other thing is that the spectrum of buyers is changing dramatically in devices, because devices are more connected now to IT. So the spectrum of the buyers is completely changing. If it was only healthcare companies in the past, now it could be Google. It could be Oracle. Who knows who's going to be the buyer? We have one company, which I just discussed with one of my partners, Mimi here. We have one company that is involving in hospital outsourcing with the patient relationship regarding his bills, regarding his liability, because it's a big problem for hospitals right now. And our buyer is not going to be Cerner. Our buyer will be Citibank. They want the data, they want the patient, and they'll know exactly what their healthcare expenditures are, so they can provide them with solutions. So the marketplace is changing, and it's not going to be the same in 24 months or 36 months.
I've got a few-part question here. I wonder, what's the smallest percentage you would consider? What's the smallest amount of dollars you would consider investing? And also, just to Ron's point, you know, if you can get an exit, grab it and go. What if you're in a situation where it's you're, say, 3 years into a deal, the company's really growing significantly, and it's doubling every year, and it's being able to kick out pretty good dividends? Would that change your mind about that? Would you be willing to ride that out and continue with it if it's very successful?
To the first part of your question, I don't consider that the percentage at the very onset. Later on, we can structure a deal. I'm much more concerned about the science. It's very simple. Does it work? Okay? I can't throw Kim Kardashian at it and make it cool. All right? It's not cool. It just works. So it's very simple for us to filter out and rank opportunities. As far as dividend, I'm old school. I don't believe in going IPO. I believe in building a company that becomes profitable, continues to grow, and as long as it keeps going and growing, hold on to it. We, as I mentioned earlier, I think, I look at the portfolio as an ecosystem, and I encourage cross-pollination. Everybody runs into a problem at some point, and we may have internally a solution to that problem. It might be machine learning issues, and we have folks on the genetic assessment side who are using machine learning to look at DNA in really interesting ways. They run into a problem, they pick up the phone, they talk to our robotics guys. They're the expert in machine learning. So I want to keep that culture, that intellectual property, as much as I can internally. Having said that, if you want to give me a hell of a lot of money, we can talk.
We don't have a minimum percent that we like to see for our investment. I will say, because we invest early, we don't tend to join very large syndicates or invest in companies that have a high pre-money. So we might end up with anything from 3 to 30%. We tend to invest $1 million per company because we find that at the stage that companies come to us, that's the right amount to fund something substantive, either a good set of IND-enabling studies, a large animal, whatever that is. So we've never done an investment that's, $250, $300. I think the smallest we ever did was $750 to start. And frankly, it's, we invest so much time and diligence that spending that time and then making a very small investment may not make sense for us.
Yeah, I would like to add, you also have to consider, is that also in terms of doing due diligence and the time, the cost of legal for us, for as an investor. So, I would say for BSI, $1 million is our sweet spot as well. I would say 5 more, but at the same time we have to consider all the time and the cost of going back into the legal side. And then in terms of the percentage of dividends, we also like to think that the company will grow and like to see them become profitable. So I agree with that, but I would like to go back into the point that if you get an offer to sell a company and it's the right offer, and your board has to prove it, right? So, it has to be in a way unanimous, but at the same time, if the offer is there and it's the right one, you have to take it, right? And continue to grow the company in a way.
From Volcano's perspective, as I kind of mentioned, the founders of the fund are very experienced medical device entrepreneurs. So we definitely consider ourselves value-added investors. We're very active with our portfolio companies. We almost always have a board seat. And so that has implications for your question in 2 ways. If we're going to invest our time and our money we need to make sure that we have a big enough stake that it's a meaningful increase. So if we have 5% of the company and we increase the value of the company by a lot, we're only capturing 5% of the value we create. So we like to have a pretty significant stake. And as far as the dollars go, you know, again, because of the due diligence costs and all the transaction costs and all that kind of stuff, we kind of struggle when we get below $1 million to make it all worthwhile. Unless it's a labor of love or a company that we're starting ourselves.
You have a question over here?
Yes, I do. I'd like to ask all the panelists, do you invest outside of the United States?
Yes,
Yes.
Yes.
absolutely. There's great innovations coming from places like my home place, Israel. There's great innovation coming from Europe. A little bit concerned about Asia in terms of protection of IP. But definitely when there is a law and order, we'll take a look at it.
Same here. We've done investments in Canada, Denmark, Israel, and looking at one very closely in France now.
It's very important for us there's got to be a legal system that will protect the investors. I mean, going back to your question, my concern is not as much how much money we make, is how to protect my investors when they get in. Because it's always rosy and everybody's optimistic when you get in, but protecting the investors. So one way to do it for us is even if we own 20% of a company or 10%, right? The number could be anywhere from zero that we're buying right now from bankruptcy to $25 million investments. What we will have is a very strong side letter to the operating agreement, allowing management to do X, Y, and Z, and letting us have a veto on a few very special items. Capital events, hiring of C-level because of the compensation issues. Definitely will head the compensation and the finance committee on the board. Those are key things for us. So we own 10% of a company that we invested last year, 10%, and we have 2 out of 5 people on the board, but we require 75% vote. That means we have veto. And it's a very nice document, 10 items that they cannot do without my veto. So we're very concerned about that because otherwise we're just going for the ride.
Let me just expand on that a little bit. What we've noticed recently is that we see a lot of really interesting projects outside, in the United States, but outside of the traditional hotbeds. Outside of the Valley, outside of this Boston to New York corridor, Chicago, and Colorado. So there's a lot of really vibrant innovation happening still in the United States. We don't have to go elsewhere necessarily. And there are many times that somebody who's located overseas actually want to come over here and do their project over here. So we don't necessarily target overseas because there's just so much exciting things happening still here. So we focus.
One thing about overseas, I'm sorry. One thing about overseas is even if it's overseas, typically 90% of the targeted market is the United States. And one of the key things that I'm looking at when I invest overseas is to make sure that there's a time frame for the management to move to the United States. Even with today's connectivity and everything, it really doesn't work. You really have to be here.
Yeah.
So that's a very key requirement to make the investment.
You have a question over here?
I just want to follow up on
Sure.
what Ron just said, to make sure, like, I've talked to about 3 or 4 investors in the last 3 weeks, 3 months, whatever, and I'm in rural Pennsylvania, I have an incredible company, and they're like, well, it takes 2 planes and one has a propeller to get there, or there's no train. So are you saying that you guys do look outside of those hubs?
Love road trips.
Yeah, because it's very, you know, I mean, we have incredible people and.
I'll comment on that. So actually, I think it is telling, I hadn't realized it until now, the 3 companies that we are currently in deep diligence with towards our next investment meeting are based in Chicago, somewhere in Ohio, and France. So none of them are in the traditional hotbeds. We've invested in the Midwest before, we've invested in a couple other kind of non-hotbed areas. The trouble I think those companies face and where we try to help them is actually talent and recruiting people in rural Pennsylvania may be more challenging as you build your company than if you were based here or in, you know, larger cities where you have access to greater talent pools. So that's one place where I do see companies struggling a bit. It hasn't made us shy away from them. It's just something we go in with, you know, we go in with open eyes, knowing that maybe we'll have to help a bit more with recruiting or be more hands-on ourselves.
And from a foreign investor point of view, I mean, we're looking at a company, we looked at a company and invested in a company in Minnesota. So we're definitely looking outside the traditional hubs, and if the opportunity is there and if the company is right, the management team is right with the right technology, definitely geography doesn't really become a factor. In fact, you know, as a foreign investor, we found the U.S. to be a safe haven for us to invest, and the dollar is strong, and we haven't found anything outside of healthcare, outside of the United States. So
it really depends what stage you are in the company, because at some point you'll have to move. If you get to a situation where you are getting acceptance in the market, there is revenue coming, people want to see you, you'll have to make this a switch, that's for sure. Early stage doesn't matter, because I also believe that sometimes management change doesn't have to be the top, but getting a good CFO that has a good track record. I find companies are not ready for an exit, for example, when they think they are. When we invest in the company, we put governance like it's a public company, because we want to be ready if something comes up that here's the data rooms already. So at some point, probably, there's a move.
Anyone else? Shoot.
So coming to a family office or single LP type investment firm, how would my pitch and my presentation differ at all to a group like yours versus a traditional VC organization?
I can start with that. We really do have what a lot of people call a double bottom line. So we really look at patient impact and the kind of health outcomes that you expect your product, device, therapeutic, or diagnostic to achieve. So when companies come to pitch to us, we tell them two things. One, because we are focused in cardiovascular disease, we know the space pretty well, so we ask them to just get straight to the technology and describe that for us. But then really when they're quantifying the opportunity, we're actually more interested in seeing it quantified in terms of number of patients you're able to address and help, and kind of the difference that your device or therapeutic will make in their care. So we want a distinct improvement over current standard of care. And by extension, we don't tend to do a lot of, or any me-toos. We don't tend to do reformulations. We don't do things that are incremental improvements on existing technology. Not that everything has to be groundbreaking and earth-shattering, but we look for a substantial impact. We do look at financials, but the first stage of diligence is always scientific and clinical impact. So that would be the big difference with us.
And to add to your point as well, I mean, the social approach for us is quite important. I mean, we want to, obviously, we want to make sure how your company will make an impact in that perspective. And at the same time, if you have a medium or long-term vision into expanding into Latin America, for us it's very important to hear, and how we may be able to help and to reach that goal.
For me, if you want our relationship to be transactional, I'll give you money, you give me back money, hopefully more money. We're done. Not interested, period. I want to know, how can I add value to your vision? Through capital, but more importantly, through other assets that we may have. Some intellectual property, perhaps, some relationships. Recruiting talent is key. So I don't know how others do it. I don't care how others do it. But I want a relationship that can last longer than just one project. As far as I'm concerned, 9 out of 10 projects fail, and I want to recycle your talent internally for another project or another vision that you might have. So if it's just transactional, go to the bank.
I think there's no real answer. For us, it's like war. There's strategy and there's tactics. So for me, if you walk in, what's your strategy? Number two, can you execute it? Are you the right team to execute it? If not, would you listen to us? If you're not going to listen to us, then we don't care, even if you have the best product in the world.
From Volcano's perspective, I don't see too big a difference between us and a traditional VC. For pure financial investors, the family has their own foundation outside of Volcano. They do philanthropy.
What's a good way to get to you guys? I mean, obviously you're highly visible here, but for folks like you, any suggestions there?
I mean, through this network is they know the family offices they have. I mean, we're not that hidden. You can Google and find BSI Capital, for instance, and we're based in Mexico. We're actually the first ones, pioneers in Mexico doing healthcare. So sometimes they reach out to us through Google, but we also maintain a very good network with our lawyers. And if you have good lawyers, they might have access to those family offices within the U.S. and also offshore. So it's a good way to start.
Yeah, I'd say the most efficient way is through someone that you already know and trust, obviously. So lawyers that you work with, portfolio CEOs, other networks and contacts you've had a long time. Next best is something like this kind of a forum. And the final would be a cold email. I think the thing to consider though is if you do your due diligence on us as investors and you know what we're looking for, what stage we're in, and it makes it a lot easier for us to give you the time to evaluate it because I get a lot of emails every day with companies that are like no fit whatsoever, and it's very easy for me to just put that in the trash bin. So to the extent that you have a pitch that's actually in our sweet spot, I'll look at it even if it's a cold email.
A cold email for us, we never see it. It's trash. It's junk. First thing, fit. We spend a lot of anguish to extract from we're intensely private. We extracted some of our thoughts and put it up on the web, at our site. We're celebrating 20 years, and we have, in fact, a campaign called The Next Big Thing that focuses on the next 20 years, what we see in terms of healthcare, education, and robotics over the next 20 years, to provide some guidance in terms of the thesis, investment thesis that we may or may not follow. Not everything is there, okay? But first, go do see if we're the right fit for you. As far as getting in touch, we have an online form that you can go through and submit, and it gets routed to the right person for review. Warm introductions are awesome. Warm introductions from the people from our employees are even better. And referrals are good. And events like this are also a good introductory way to develop a relationship. So if you think we're a good fit for you, let's talk.
So I would echo all of that warm introductions are always better. And I just want to say a couple words to demystify that so it doesn't sound harsh in any way. But when we think about the risks we take on in any given investment, we're always assessing all the usual things, the technology risk, regulatory risk, etc. There's also the management risk. A warm introduction immediately de-risks that just enough that we can feel comfortable. We're more likely to take the call, set up a meeting, really hear the story. We have invested in companies that came through completely cold emails, just kind of dropped in through our website portal. But we spent a lot more time diligencing those teams up front before we could get comfortable with the idea of an investment. So you know, anytime you can find a way to network into any of our groups, I think it helps take that first step.
Go ahead.
The question is about fit, and I don't remember what all of you were looking for, but I remember cardiovascular and cancer. Do you look at adjacent opportunities to those? I mean, you know, there are a lot of plays that are directly in the cancer or the you know, cardiovascular space, but in my case, we have a medical technology that is on the periphery of that, but actually it's important to the condition, but it's not directly related. Do you look at those types of opportunities?
Absolutely.
Yeah.
Absolutely.
I'll give you an example. If we're doing genomics and we're doing big data analysis, data integrity, data security happens to be an important thing. Okay? That's not a med school thing, all right? That's a computer science thing. So we look at opportunities like that that support the overall thesis. So absolutely, yes.
Always important
Always important what?
to look at
Adjacent.
adjacent. Yeah. Sometimes it's a bigger opportunity than the main cause because there's too many competitors in the main cause.